Yeah, so something that I've been confused about insurance companies and the way that prices are determined is like, I guess I just don't know why it would be more expensive. Is it just because there's a third party involved? Because I think that a lot of people in America, they think that these insurance companies are lifting the price off their shoulders. So when you tell them, well, you don't need insurance, you can just have an agreement with your doctor, they're like, well, but who's going to cover the cost?
Well, I mean, we should remember too, it's not totally the insurance company's fault. I mean, they're trying to reduce costs. They have an incentive to do that, so they can make a profit, and they are dealing with a lot of regulation. So there's a lot of, we talked about the ACA. There's a lot of mandates on insurance companies that says that they have to offer coverage for particular things, even if the people they're covering don't want those things or don't need those things. So that drives up the cost. In addition to that, I mean, there's this thing called network adequacy. So that's what I learned about in the insurance commissioner's office in my past job, and it's this idea that so say you were trying to start a burger joint, a new burger joint. You're going to offer sandwiches to folks, and you apply to the regulator of burger joints, and in order to be licensed, you have to buy land and put a facility on every street corner that McDonald's also has a burger joint in order to get licensed and qualify as a legitimate burger joint. That's what network adequacy is for insurance companies. So it really limits, kind of newcomers from coming into the marketplace and saying, well, we're just going to cover a small area of the state. We're not going to go to the whole state. There's laws that say that insurance companies have to offer coverage to 85% of the state. So that's a big barrier too. That increases costs. But beyond regulations, it really gets back to who pays. So it's, I think, the classic example that Milton Friedman gave about the economization of value. So it's, if someone else is spending someone else's money, there's not a lot of incentive to spend it wisely. But if I'm spending my own money for myself, I have a very high incentive to spend it very wisely and seek the highest value. And with insurance companies and different middlemen involved with your healthcare dollar, there's a lot of ways that they aren't seeking the highest value, and they're really just looking to maximize their profits. So there is a lot of kind of that predatory behavior in this middleman system. And the other thing we deal with too is, especially in a state like Montana, is really truly regional monopolies. You have these hospitals that control large swaths of the state and different healthcare populations, and insurance companies, their hands are really tied when they go in and they need to cover that portion of the state under the regulations that we just talked about, but they really just have to kind of take whatever price that hospital wants to charge. And they can negotiate as much as they can, but at the end of the day, it's kind of in the hospital's purview to charge whatever they want. So that creates a recipe for really high costs. And so from my perspective, really the real answer here is reducing restrictions on supply. So we need to boost more competition and choice in the marketplace, reduce regulations on building new hospitals and new healthcare facilities, reduce restrictions on new medical providers getting licensed, and then also stop these subsidy programs that give unfair subsidies for these monopolistic actors and these big hospitals and things like that. I think that would go a long way to getting us back to a market-oriented system.
Yeah, because I've heard it explained that like the healthcare facilities will look at your insurance plan and then determine what they can charge you based off of that plan. So, I mean, is that an accurate portrayal of how it happens?
Yeah, and in fact, they're contractually bound to do that. So I mean, they enter into network agreements with insurance companies. So if I'm a hospital, I enter into a network agreement, and what that means is that all of the insurance company's members can go to my hospital and get an in-network rate. And so that's a rate that I've negotiated between my company, the hospital, and the insurance company. But really, what those rates end up being is a percent of discount off of the hospital's charges. But remember, what are the hospital's charges? It's whatever they want it to be. And when you have the hands tied of insurance companies, it really it limits their ability to negotiate that down farther. In addition to that, we talked about the prospective payment system of these government programs, which that's not based in negotiation at all. It's basically this commission or panel that sets prices based upon how much resources they think goes into delivering that service and how much those might cost. So it's a truly messed up system.